Jacob is a 28 years old British male, presented with swelling in the right buttock for 8 days, which gradually increased in size. Along with the swelling, he had throbbing type, continuous, non-radiating pain over the area associated with the local rise of temperature. He had no medical history of local trauma, discharge from swelling, fever, or vomiting. He had no similar episode in the past and not any known history of chronic illness till date. On physical examination, vitals were stable and systemic examination was normal. He had swelling on his right buttock lateral to the anal opening. Body temperature was raised along with tenderness. Different laboratory tests were performed. All the blood parameters were in their normal limits. Serology test was negative. For making a diagnosis, complete rectal examination and computerized axial tomography scan was performed, which showed a large right-sided abscess. Our patient met the diagnostic criteria of anorectal abscess by having uncontrollable pain along with the swelling and raised body temperature. Thus, taking into consideration the physical examination of Jacob and his laboratory and scanning results, the doctor proposed anorectal abscess as the most suitable suspected diagnosis. He was recommended for rectal surgery. How will you further move towards the right treatment? What type of surgical treatment is necessary for Jacob? And how will you treat your Jacob? It will be easier to answer these questions when you have a thorough understanding of anorectal abscesses. sqadia.com is bringing a complete lecture of more than 40 minutes on anorectal abscesses, along with the short clips for quick learning. You can watch these videos on sqadia.com to solve this case study. Simply go to the sqadia.com, subscribe, and get a free trial of 2 days.